I love this topic that Ashley is focusing on today, a program at Unity Hospital that is helping patients who have suffered traumatic brain injuries.
Yeah, one part of the program focuses on cognitive abilities. Really fascinating stuff. So this morning, Ashley is learning more on just how it helps.
Yeah, we have a really interesting piece of technology here. Andrea, what is this? It's called BITS, right?
Yes.
So what does this do?
So the BITS we use is a technological tool, and it's supplemental evaluation, as well as we can use it in our treatment planning. And what exactly it addresses is the visual perceptual difficulties as well as cognitive impairments after a brain injury. So visual perceptual, I mean, is how the brain is processing what exactly we're seeing. So we typically see some visual spatial difficulties, and Chris, after your injury, you had some impairments, so we use this as a treatment guideline. So the first one I want to show is just a visual one.
Okay.
And this is one that he also did. We're making it a little harder now that he's doing well. He did it in a wheelchair when he was here.
Do you remember using this and when you were here? Do you remember?
Yes, I would have a mallet.
Oh, you had a
because
mallet.
I was down here.
You were in the wheelchair when you were doing this.
Yes.
Okay.
Yeah, so now we can upgrade him and do it in standing. So here we can work on standing balance, endurance, as well as functional reach out of base of support.
Nice.
So here we'll do one with, it's a reaction time, but it's looking at his visual field, how he's seeing things left to right. And we can change it to make it more difficult and less difficult. All right, let's do here. All right, when you're ready, press the middle. All right, find all the dots as fast as you can.
What is this like for you, Chris?
This is interesting, and I am trying my hardest to not mess up.
Because it's live. You were like, I can't do it. I have to do it live.
Right. I'm
You're
like,
doing a
the
great
pressure
job.
is real right
But
now.
some of the therapists that worked with you, Laura was one of them. Laura had the camera down her nose this last time, but you
Right.
said you worked with Chris, and what did you say about his recovery seeing this?
Well, I think we don't often get to see patients 2 years after their injury. Sometimes we never see them again, but from where Chris was from a cognitive standpoint to where he is now, it's one of the most exceptional recoveries I've witnessed.
Yeah.
And he claims he still has a far way to go, and I'm sure he has his goals that he wants to achieve, but it's really fantastic for myself and Lauren, who also was a speech pathologist working with him, for us to see him back in school and doing so well. So.
Yeah. And you said you still have some goals that you want to. You notice some things, but when you hear them saying you come a long way, what do you think? What goes through your mind?
Super uplifting, and it's showing the compassion and love that they have for me. And I'm super grateful, but I still can't help but push myself to, I could do that, and I don't get mean to myself, but I still see the distance that I could cover.
Yeah.
So
How'd you do on this? Was it
did
okay?
Pretty well.
Okay. Do you want to show them the other part of the
This is more of the cognitive piece. So he was having a little difficulty with that when he was here, and that's where we overlap with speech therapy as well. So we both address cognition. So we'll do a medium pattern for him today, medium difficulty. All right, Chris, what I want you to do, when I press this, I want you to look at the pattern on the right side, okay? And try to look at it and remember it as much as you can, and then you're going to draw on your left side, okay? So this addresses visual memory.
Okay. So it kind of stays up there and then goes away.
Yeah.
Oh my goodness.
You're doing great. Good. Let's see how you did. Hey, good
You
job.
did it. That was a lot of pressure, huh? Yeah. But things like this, when you said you still have things that you notice, is that kind of a memory thing, or what do you mean by when you said you still have things that you notice that are different?
Well, when I got my neuropsychology exam in Maine when I moved back home, they saw that I was traumatically impaired in a few different places, and I see that, and I was like, that shouldn't happen. I should be able to figure something like that out. And that was relatively medium, but the hard ones, I'm like, why can't I do that? So I just want to get there, and I see that I potentially could, so I really want to push myself to see if I can.
He loves a challenge, don't you? He loves a challenge. But this is, again, just one way we've been showing you the different ways that they are helping. Again, March is Brain Injury Awareness Month, so we're just showing you the amazing things going on right here in our own backyard.
Wow, we just keep going, whoa, whoa, whoa.
Jaw dropped over here. It's just amazing to watch how creative they've gotten with these, what looks like a game. I can see even kids able to engage in it.
Training the brain.
Amazing stuff.